Hi everyone, Candace Heron, nurse practitioner from Hometown Primary Care here today. I was going to talk a little bit today about women's hormones. Now, it has been a very big, hot topic recently about perimenopause and about menopause, postmenopause, and all of the options out there. So I'd like to start with the fact that we offer memberships that include all of your medication, all of your lab work, and all of your visits. The reason we do this is because not always does insurance cover hormones, especially for women, but also sometimes for men. So we do memberships so that it is a set price for everything that you're going to need to feel the best that you can feel. So first, whenever we are talking about perimenopause, so before you've actually stopped having periods, we are talking most of the time about progesterone and testosterone. Now, progesterone is one of my favorite hormones because it helps you feel more calm. It helps you to have less episodes of waking up at night. It helps you to be able to fall asleep at night, which is a lot of problem for women in perimenopause. We just wake up and our brains just won't stop and we can't sleep through the night. So progesterone helps with that. Now, people have previously not given it if you don't have a uterus. So if you've had a hysterectomy, they were like, oh, well, you don't need any progesterone. Well, that's not the only reason to give it. Yes, we like to protect a uterus, but that's not the only reason to give it. If your body had progesterone previously, it should still have progesterone now. And that is why you should be giving it. So now that is one of the first things to fall whenever you're in perimenopause is your progesterone. Next is going to be your testosterone. And yes, we have testosterone. Even though we don't have a huge amount like men do, we do have some. So when you are running low on testosterone, you normally have issues with brain fog, decreased motivation just in life in general. You're not able to do the things you were able to do previously, and you are maybe more tired whenever you work out. You don't do the workouts. Kind of the same thing for men as for women. We just don't have as much testosterone as men do. So with that said, there is no FDA approved dose for women. So there is no insurance company on earth that's going to pay for you to get something that is not FDA approved for a dose for women because there's nothing commercially available. So the only way that you can get testosterone is if you pay cash for it. That is another reason why our memberships include this medication if you need it to be given in the membership. Now, on a lab result, a woman's testosterone can be 2 and it be considered normal. There's not a woman I know that a 2 feels normal. So this is where we can't just treat the lab reference ranges and not treat someone's symptoms. We were told many, many, many times in nursing school and then in nurse practitioner school, don't treat numbers, treat the patient. And yet with hormone replacement, often it's, well, your numbers are normal. That's not what we were taught. And that is not a dig to any of my colleagues. That is the way that hormone replacement therapy has worked for the last 20 years because of this study that was done that was incorrect as far as how it was done. It was incorrect on who it was done on, and the results were not accurate. So I won't really go into that on this one, but we do have testosterone in our body, and when it is low, for us, we feel differently. Just as if a man had a lower testosterone, they feel differently. Now, estrogen in perimenopause is kind of all over the place. It can be high one day, low the next. So, unless it's low consistently, and you're having symptoms of low estrogen, then normally that is not one that we really mess with a whole lot or give you a supplement of. In my clinic, in my experience, it is not nearly as widespread as progesterone and testosterone are in perimenopause. Once you've hit menopause, postmenopause, and you are no longer having periods, then yes, we do give estradiol. Now, you may ask why I don't use words like progestin or estrogen. That is because we are using the most bioidentical to your body, because that is what your body makes. And synthetic hormones are like, as a mentor of mine says, Franken hormones, and they're not like our body. So we want to use the most bioidentical as we can. And that is what we do at Hometown Primary Care. So we use progesterone, micronized progesterone, and estradiol. We also use compounded testosterone, and we have a local and online pharmacies that both can supply these. But again, if you're doing it through our membership, it is covered because we cover it in the membership. As well, we do check labs for you multiple times throughout the year to make sure we are getting you in a range where you feel well and your labs reflect this. And whenever we do that, that is included in your membership. Now, you can always see if your insurance will cover these things, but they will not cover testosterone. So that's not even something that you're going to be able to get covered. So we would recommend that you do the membership if you are going to need testosterone as well, or you will be paying out of pocket for it when you go to the pharmacy, which is fine, but you won't be able to get it from any of the commercial pharmacies. It'll have to be a compounding pharmacy, and we have 2 very great local compounding pharmacies that we use. So if you'd like more information, please give us a call at 405-591-3584, or you can find us at www.thehometownprimarycare.com, and we'd be happy to answer any questions that you have. Have a great evening.